Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today I am here with my beautiful staff member Rachel, who has volunteered to let us use her face to kind of demonstrate how we might look at a face from an aesthetic perspective and see what sort of small tweaks we can make to bring out more beautiful features in our patients. It's all about facial balancing for me. So, I really like to kind of study the face and take a look where the opportunities are that can be improved upon and how the face has maybe aged over time and we can restore it to that more youthful appearance. Rachel is very beautiful. She has noticed sort of an asymmetry in her lips, especially when she smiles. She notices a little bit more of that asymmetry. So what we're planning to do is just add a little bit more filler, especially to one side of her mouth. We also would like to take a look at her cheeks and see if we can just add a tiny bit of filler to the lateral cheeks. She actually has a very nice volume in her central face already, so that is excellent. The other opportunity that I see with Rachel is her chin area. And you really can't see this on the video so much, but even at rest, her mentalis muscle is twitching and she notices a lot of grinding and tension in her TMJ, jawline area, and that can sometimes even lead to migraines and headaches. So it'll be really helpful to relax this mentalis muscle. We'll also inject a little bit of Botox in the DAO muscle here to prevent this downturn of her mouth, which sometimes, I did not know this term previously, but one of my patients told me that she has an RBF. So that is the resting B face. And actually we can fix that with just a little bit of Botox in the DAO muscle, and it's just absolutely amazing. So the last patient I did this with, her mom noticed an immediate improvement, and even though the patient really couldn't tell, others around you will notice that you just look a little happier because it prevents you from looking kind of down and sad all the time. So I love actually treating this, and I can identify that easily in the patients and often suggest it. So that is kind of the plan. I think with Rachel, of course, I do want to add a little bit of filler in the chin area as well. And if you look from the side, Rachel's chin is recessed back a little bit. I would like to see that come forward just a bit to restore more symmetry in her profile and her front view, and that will give her a little bit more prominence in the chin, a little bit more prominence in the cheek, because we really want to bring the focus to her upper face. A lot of our patients begin to lose temple volume, like right in here, and it actually makes a very nice improvement to add temple filler and sometimes even a little bit of forehead filler to make that look more youthful. So I always kind of like to start at the top and then work my way down the face. In some patients, we may even consider threads just to lift up the cheeks, and we can add PDO threads. They last about 18 months. But even as they dissolve, they are stimulating new collagen growth in your skin, and it keeps that tissue kind of tightened underneath. So it's another nice way to get a non-surgical facelift in our patients. If there's more laxity in the chin area, we might consider procedures such as FaceTite, Ultherapy, Morpheus 8, maybe even a little bit of Kybella injections. We can even use Botox in the neck to relax the platysmal bands and give you an instant neck lift. So just so many different options. Everything has to be customized for each patient, but it's a lot of fun, and just little tweaks here and there can make a really big difference. So we will go ahead and inject a little bit and give you an update. Okay, so we are going to start by injecting our neurotoxins first, and in Rachel's case, we are going to inject her mentalis muscle here, which actually, if you look really close, you can actually see it quivering even now at rest. If you come a little closer, you can take a look at that. I don't know if you guys can appreciate it. So we'll go ahead and inject a few units of Botox into her mentalis muscle. And then we are going to inject a little bit also into the DAO. So we'll do that next. And this will prevent her from pulling her mouth down and her chin up and sort of making this sort of an expression. It will keep things looking a little more up. So there are many different types of fillers that we can use in aesthetics. The types of fillers that we use include hyaluronic acid fillers, Radiesse, which is a calcium hydroxyapatite filler that's a stimulatory filler and helps to build collagen. And then we have a filler also called Bellafill that has an indication of 5+ years and is also a stimulatory filler and builds collagen. And then we also have Sculptra, which is PLLA, and it is small fine particles of almost like ground suture material. And when injected under the skin, it also helps to build collagen and can last anywhere from 2 to 3 years. So we use all these different fillers based on what we're trying to achieve and also where we are injecting the filler. For example, if we're injecting the under eye area or the lips, we can only use hyaluronic acid in those areas. If we don't want to use fillers, other options would be PRP or even threads to help soften the under eye hollowing, and that can also be done in the lip area. There are, of course, different types of hyaluronic acid fillers. Some of them are not as thick and others add a lot more volume, and the longevity can also vary, where some hyaluronic acid fillers may be gone in 6 months and others may last up to a couple of years. The newest category in that are the RHA fillers. So this is resistant hyaluronic acid, and the strands are a bit longer and they stay in your skin longer. They do not degrade as quickly, and they also integrate with your tissue a little bit easier and faster, so you don't get clumping or movement of the filler into other areas as much. So we're starting to use a lot of the RHA filler, and I really enjoy that. But any of them work pretty well for other areas of the face. You know, Rachel is younger, but in some of our patients who start to show aging in the temples, and that can happen even at an early age, I really highly recommend starting to fill the temples. I often like to fill behind the hairline or actually in the scalp itself, and that really helps to bring more projection of the upper face and also at the same time lifts the lower face up. It's really amazing. Sometimes we'll just do face treatments to bring things up with threads and fillers, and we'll notice that the neck improves greatly as a result. So, you know, these are just fun ways that we have to, in a non-invasive manner and in a fairly quick fashion, improve your appearance without needing surgery or much recovery time. So we'll just kind of look for our landmarks here, and I like to go deep with the hyaluronic acid fillers. If they're injected too superficially, they can sometimes appear kind of bluish and give a bluish tint to the skin called Tyndall effect. So we want to definitely avoid that. I could have chosen any of the fillers in this area, even Radiesse would have been a good choice, but sometimes hyaluronic acid fillers are nice in that they actually attract water and give us a little bit more of a fuller appearance. So just a little bit of filler and it looks so pretty already. You can already see a nice contour taking effect and just shaping out of her face, and a little bit more of a lifted appearance on this side already. Actually, she looks slimmer. That's the other thing. A lot of times patients think, oh, if I get filler, am I just going to look fat or chubby? And it actually usually works the opposite. If we place the filler in the correct position, it'll make you look slimmer and more contoured.